Okay, here we are with Helen. And Helen, can you share with me what brought you into the office?
What brought me into the office was chronic pain.
Okay.
And I was told that I had fibromyalgia.
Mm-hmm.
And never was adequately treated by the doctors that I went to. They handed me drugs and sent me home.
Right. And how well did that work for you?
It did not work for me.
Did not work for you. Okay. So you found you had a friend of yours who really cared about you.
Yes.
Sent you to our office.
Yes.
And in addition to the chronic pain, we also had a chronic low energy too.
Yes.
Right. And with the low energy, how is that affecting your daily activity?
I was just kind of in a survival mode. And kind of cranky all the time because I wasn't sleeping well, and just not. I was just living.
Not living life.
No,
you're just surviving. Every day was a survival.
Yes.
Okay. And the biggest wins that can you share the biggest wins you've had so far with our treatment?
The biggest wins is that I sleep. And I have more energy. And my system is working better because I've changed the way I eat. And I feel like I've got my life back. And
that's wonderful.
And I'm not even quite out of the woods yet. And I feel that good.
But you feel that good. That's awesome.
Yes.
And it's going to keep getting better.
Yes.
And so that's a great story to share. And what we're going to do is we're actually going to show some whoever watches this video, kind of a pre and post of when we do some neurological therapy. It's called brain-based therapy, and what it does is it's a system that tells us what parts of the brain aren't firing properly, and based on our evaluation, we determined that your right cerebellum is under firing compared to your left side, and so as a result of that, it's setting you up for health problems because the brain kind of runs the body, and when we have a weak cerebellum, we usually have a part of the upper brainstem called the mesencephalum that overfires, which creates overstimulation of the whole sympathetic nervous system, which puts your body into a fight or flight. You get whole body pain, can't sleep, digestive issues, and it's pretty much what causes fibromyalgia, at least on a neurological level. So we're going to do some neurological tests because we're still in therapy now, and so we're going to do some neurological tests, and then we're going to do some treatment, and then we're going to get a post video. All right. So here's what I want you to do. Can you do that? Can you do that? Tandem gait where the right foot is back. Keep your eyes open, and we're just going to see what happens. Yeah, you just get completely have challenges. Okay, here we are with Helen again, and what we did is we did what's called a caloric. What we did is we put warm water up against the eardrum, and there's some nerves behind the eardrum, and what that does is that fires into the cerebellum to strengthen the right side of the cerebellum, which is weak in your case. It also fires into the parietal lobe. Your cerebellum is very important for balance, coordinated movements of the body, and also the tone to the spinal muscles. So Helen, go ahead and get in that position again when your right foot is back of your left, and let's see if we're doing better. Okay. All right. Very good. That's much better. Do you see how much dramatically different that is? You're just really doing good there.
Oh,
excellent. Good job. So that's your new therapy. We're going to keep working on this, and we'll just keep working with you.
Okay.